As we all navigate the COVID-19 pandemic, it's now more important than ever to have a health plan that works for your family. Open enrollment is coming up where you can choose to change your plan or find a new one. Rebecca Madsen is the Chief Consumer Officer for United Healthcare, and she has some tips to navigate this season. Good morning to you, Rebecca.
Good morning to you.
Thanks for joining us. Let's chat about this a little bit. Open enrollment for healthcare. When does it start? How long does it last?
So open enrollment's the time in the fall when you can pick your health benefits for the coming year. If you're in an employer-sponsored plan, if you're in a Medicare plan, or if you're in a state-based exchange, it's usually about 6 weeks in the fall, and so it'll help you prepare to have a good plan for the coming year.
Perfect. Do you have any tips, when it comes to just, I guess, deciding how to pick a plan?
Absolutely. There's 3 things as an easy way to start. First is look at changes. We know so much has changed in the world. You may want more comprehensive coverage. But also look at your own life and see, are you sick or are you healthier? Do you have a new medication or a planned procedure? The second is looking at cost. Not only the premium, that's the amount you pay out of pocket every month, but also the deductible. That's the amount you pay before your insurance kicks in, and people can get cost surprises if they're not aware of their deductible. And the last thing is look at coverage. Make sure that your providers are in network, that your medications are covered on the plan that you're selecting, and that's a good way to get not only effective care, but also make sure that it's affordable for you and cost-effective as well.
I think it's great that you pointed that out because Wisconsin, is one where you definitely need to look at the hospitals you choose and the doctors you choose as well. So let's talk about some different trends, though, going on that have kind of come up in healthcare due to the pandemic. I feel like telehealth is just at the forefront of every sort of medicine and medical program.
Yeah, we know that more than double the number of people are interested in telemedicine now, up to 91%, and it makes perfect sense given what's gone on in the past 5 months with the pandemic. It's a great way to get care 24/7 in your home from a qualified medical professional who can not only diagnose you, but can do things such as write prescriptions. Many insurance carriers have waived the cost for telemedicine, and even in a normal time, it's much less expensive, and it's also safe if people don't feel comfortable leaving their homes. Even though now you can get what's called non-essential care that you couldn't get before, telemedicine is still a great option for people.
Do you switch your doctor? Do you stay with your doctor on that? Or do you just kind of choose who's available?
So often through your insurance carrier's website, you can find something that says telemedicine. You can do it a lot of times on an app as well, and it'll connect you with a whole host of providers that are available to actually treat what it is that you need to be diagnosed. So you have everything from an internist to if you have a specific condition. You can select that when you're going in and make sure that you get the right provider on the line. You also have, for some of the larger medical groups, they offer telemedicine, and so you can go and make sure that you're connected to the group that you're interested in through the provider group, and all of it is done electronically, so it's super easy. You just sign up, click, and go.
I love that, and I liked how easy it was when you were seeing some of the video of just pressing the buttons. How long have you felt this? Different things like that. Very easy to navigate for people. You mentioned, saving money on some of those co-pays. Are there other ways that you can save money within a plan?
There's 2 other things you should look at. One is wellness programs. So we know during the pandemic, 68% of people say their walking is their preferred activity. 30% say their diet's gotten worse. So make sure you look for a wellness program where you can engage in things such as walking programs or weight management programs and not only get healthier, but earn incentives. About 70% of employers offer them, and they have up to around $800 in incentives to be able to get you healthier, but also put money in your pocket. Another thing is look for a health savings account. That's an opportunity to put money away tax-free. You put it in tax-free, it accumulates interest tax-free, and you can withdraw it without any tax implications for a qualified medical expense. So another great way to put money aside for an unforeseen expense without the tax ramifications.
Love it. Great ways to stay healthy. I hear that there's someone you want to say a special hello to, Rebecca.
Yes, my in-laws live in Burlington, Wisconsin, and my husband has 7 siblings the majority of them are in and around the Milwaukee area, so hi to the family.
Hi, family. That's so great. I love it. Love to hear
Hi,
that local
family.
connection. Thanks so much for joining us with info on the open enrollment. We really appreciate it, Rebecca.
Of course. Thank you so much for having me.
Absolutely. Here's the website where you can learn more for the open enrollment with United Healthcare. It's uhc.com/open enrollment.